And then, I mean, the first procedure is about, the first procedure is colostomy. Yes? Who prepared the information about colostomy?
Yes, ma'am. Me, Reena, Vidya, Rohita.
Reena and who?
Vidya, Rohita.
Okay, so now you may start. And so what I need to do first is to allow you to, yes, to share the screen. This is this option. Okay, so you may share your presentation with us. Yes, Rina?
Ma'am, can you see?
Yes, we can see. Start, please.
Yes, ma'am. We have done about colostomy. Here, with myself, Reena and Rohita perform this. First of all, what is colostomy? It is an operation that creates an opening for the colon or large intestine through the abdomen, and it may be temporary or permanent. It is usually done after bowel surgery or injury. Most permanent colostomies are end colostomies, while many temporary colostomies bring the side of the colon up to an opening in the abdomen. It's usually needed because a problem is causing the colon to not work properly, or a disease is affecting a part of the colon and it needs to be removed. Now I would like to hand over it to Reena, ma'am.
Ma'am. It is the procedure about how we prepare. First of all, doctor likely to ask the patient to fast at least for 12 hours, and it is before surgery, and the doctor will suggest to the patient only drink water and not to eat solid foods for few days before surgery, and you will be given a means a doctor will say to patient that by this you will give laxative or enema to take the night before the surgery, after the surgery, to help the cleanse your bowel, and you should be prepared to stay in the hospital for 3 to 7 days. Afterwards, what is expected after colostomy? After colostomy surgery, some people use colostomy bags for removal of waste. Sometimes you may feel very tired. Your belly may be sore, and you will probably need pain medicine for a week or two. Means week or 2 weeks. The stoma itself will also reduce in size. Over about a 6-week period, as the inflammation reduces. you will be restricted for the first 6 weeks post observe. It is a period like post operatively, and but after this, it should not stop you doing anything you would like to do in the life. Now I would like to hand over to Rohita ma'am.
Side effects are complications for colostomy, ma'am. And it's some complications it's occur following colostomy surgery, and it sometimes it leads to side effects abdominal hernia, intestinal obstruction, and skin irritation, infection, and depression, ma'am.
Okay, is it all?
Yes, ma'am.
Now we can invite the questions from the other students. Do you have any questions? No questions. Okay. So thank you. Everything was clear and it was illustrated. And so all the side effects are mentioned. Very informative. So thank you. That was about colostomy. And the second just procedure we should speak about is this complicated, just name the abbreviation for which is ERCP. Who has prepared this presentation?
Ma'am, actually it was given to Khadija and Musharraf. Musharraf is absent today and Khadija had some bank work, so she didn't join the meeting now.
So Khadija is not with us now, right?
Even Musharraf is not with us.
Okay. Mhm. So the next procedure, which was bronchoscopy. So who has prepared the information about bronchoscopy?
Ma'am, it's me and Afnan.
Who? Your name?
Lahari, ma'am.
Lahari. Okay. So and who is your partner in this presentation?
Afnan.
Afnan. Okay. So can you start?
Yeah, ma'am.
Mhm.
Ma'am, can you see my presentation?
Yes, you can.
Yeah, ma'am. Our topic is bronchoscopy. It is done by me and myself, Lahari, and Afnan Kausar. So the bronchoscopy is a procedure to look directly at the airways in the lungs using a thin lightened tube. The bronchoscope is put in the nose or mouth. It is moved down the throat and windpipe and into the airways. It is done, and the preparations are
So we don't hear you, Lahari.
Ma'am, can you hear me?
Yes, now we can. Mhm.
Yeah, ma'am. The preparations before the bronchoscopy are like the patient should do not eat or drink after the midnight or on the night before the bronchoscopy, or if the patient take any medication daily, he should ask their doctor that that they should take it on the day of the procedure. And on the day of the procedure, the patient should be asked to remove your glasses or anything like lenses, hear aids, like removable bridges. These all should not be during this procedure. So the patient can expect after bronchoscopy like They may feel tired for 1 or 2 days, and their mouth may feel very dry for several hours after this procedure. And they may also have sore throat or a hoarse voice for a few days. These may be like gone through by gargling with warm salt water may help them to clear their sore throat. And the next one, like the bronchoscopy could be reliable for procedure for TBA diagnosis in critically ill non-neutropenic patients, and whitish plaques, ulcers where the prominent bronchoscope changes with reasonable diagnostic accuracy for prediction of TBA. Here, TBA means tracheobronchial amyloidosis, and the complications and side effects are like their nose and throat may be a little sore for a day or so afterwards, and they may feel tired or sleepy for several hours, like caused by the sedative. So there is a slightly increased risk of developing a throat or chest infection following a bronchoscopy. If you had a biopsy taken, you may cough up a little blood a few times in the following day or so. Rarely, a bronchoscopy can cause damage to the lung. This is more likely to occur if a specialized sample of lung tissue is taken. Serious complications from the bronchoscopy are extremely rare, ma'am. So, common complications may include shortness of breath, a drop in oxygen level during the procedure, chest pain, and cough. In addition, if a lung biopsy is necessary, it may cause leakage of air called pneumothorax or bleeding from the lung.
Is that all?
Yes, ma'am.
Mhm. So, okay. So, do we have any questions about this presentation? I have a question about the abbreviation that you mentioned on one of the slides when you were speaking about results. Yes, TBA.
Yes,
what does it mean? TBA.
It means tracheobronchial amyloidosis.
I see. Okay, thank you. Well, very also just interesting information about this procedure. And thank you. And the fourth procedure, what is it? So, I mean, this is just a minute. So this is herniorrhaphy, right? So, and who was responsible for preparing information about this?
Yes, ma'am. This is Bhunesh and Pradeep Kumar.
Bhunesh?
Yes, ma'am.
So please start.
Ma'am, can you see my screen?
Yes.
Yes, ma'am.
Herniorrhaphy.
It's a procedure where any abnormality extensions caused in the abdominal, ma'am. First of all, herniorrhaphy means it's a surgical repair of an hernia. It may be any abnormality caused in an abdominal wall of either of the sexes of a male or female. Maybe the abdominal wall muscle may be loosens and it causes weakness and some causes extinctions and maybe lost their connection of their blood vessels and maybe it will undergo necrosis for some period and has it may cause some pain, ma'am, in the abdominal wall. Has to remove through a surgical process, which we call as an hemotherapy, ma'am. In which, as here mentioned, that muscle of your abdominal wall. And for these procedures, we have to prepare for an patient, ma'am. Before the procedure, he should not have any food, maybe in a food or an air drinking procedure throughout the 6 hours before, or maybe before the operation. He should not have in a bath or maybe any applications like perfumes, lotions, any nail polishes applied around that area. And there will be no shaving at that area also, ma'am. And expected effects about the hernia is it's a repair of a hernia, and which is maybe causing pain to that area, so it has to be removed. And it may also feel tired and have less energy than the normal, man. To feel it better a few days, admit the probably feels much as in the 7 days. Yes, ma'am. The small hernia may not cause any symptoms, and which may not, it may be, he can feel it that by touching it, but it may cause not, it may does not cause any symptoms, ma'am. In general, herniography surgeries is classified in, we are having different types of an hernia like inguinal and abdominal hernia and umbilical hernia, that and all. We are discussing about the normal herniography, ma'am, so that we are not mentioned about here, that and all. And it may cause side effects like infections and maybe a tissue damage around that area, and constipation or slow bowel movements or irregular movements, which is causing to the intestine. And it may cause some inabilities or the difficulty in urination, and maybe incontinuous or urine leakage around that area. Yes, ma'am. Welcome.
Mhm. Do we have any questions to the speaker? No questions. Okay, so thank you, Puranesh. And so the next procedure we're going to speak about is blood test, right? So who has prepared information about blood test?
I, Mayuka and Bhargavi, ma'am.
Okay, start please.
Yes, ma'am. We created a leaflet about blood test and like questions, general questions raised by the patient, so that he will be cleared with the doubts and can be relaxed during the procedure. So the questions are like, what preparation do I need to do before a blood test? If it's a normal general blood test, there are no much preparations required. But if it's a clinical one, we prefer you to not to have anything 3 hours before the clinical blood test, because that might affect the food which the patient took, might affect the glucose levels or any other levels in the blood, might increase or decrease, anything might happen. And we request you to avoid alcohol 1-2 days prior the test, because that might affect the test results too. And we would like you to stop smoking 1 hour prior to the test. And if required, you can drink water. It's up to the patient. And the patient must need to inform the medication. If he's taking any regular medication, he need to inform it to the doctor or the person who is taking the blood, so that it can be clear to the nurse or the person who is taking it. And what can I expect after the blood test? Like, most people are ready to go after home, like after the test they can go home. There are no much like post side effects. But if the nurse drew much blood from the patient, he might experience dizziness, so we suggest him to take a rest for 10 minutes for a while. And he can take some food which can increase the glucose level in the blood. And the injected site might hurt, so gently rub with a cotton ball. And now my teammate Bhargavi will continue.
Yes, ma'am. So the next question which can be arised from the patient is blood test reliable? So yes, the blood test is reliable, as we can like from the normal blood test we can just see the blood count or the hemoglobin, but clinical blood tests may identify some diseases or may detect diseases such as diabetes, or whether the patient is suffering from hypothyroid or hyperthyroidism, and uh, it may also detect whether the organs are functioning properly or not. But this blood test only detects the abnormalities, but not how they are caused. And the next is, are there any side effects or complications from the blood test? So in most of the cases, in most of the blood tests, there will be no complications, and maybe the patient can feel dizzy because there is a loss of blood, that is, we're taking out the blood, and sometimes it may feel irritation near the injected from the place where we take the blood, because of the tape which we use, or the tape which we use, and in only rare cases the blood losses may not stop. It can cause bleeding, and sometimes soreness also occur at the injection site. Thank you.
Okay, thank you. So do we have any questions to the speakers? No questions. So thank you. And we now move to the next procedure, hemotherapy. Hemotherapy.
Ma'am, it's done by me, Manish and Sohita. Ma'am.
Manish and Sohita. Okay, so start please.
Can you see my screen, ma'am?
Yes, we can.
Yeah, ma'am. Here's the leaflet about hemotherapy that is done by myself, Manish, and Sohita. The first question which arises is, firstly, the hemotherapy is treating people using blood and the blood products like platelets from blood donation. The first question is preparation for hemotherapy. First, we conduct a blood test to confirm the blood group of the patient. We have four main types of blood groups, and we also have to check the RH group of the patient and the donor to avoid reactions. And in the picture, we can see different blood groups and their donors and receivers. A day before this procedure, the patient is advised to eat light food and make sure that they are hydrated. The patient's medical history and consent will be taken before the procedure. The donor's medical history will also be checked. And during
Just a second. I'm sorry.
It's okay.
1 minute, ma'am. Can you see it now?
Yes.
Manish?
Ma'am, in the second slide, during hemotherapy, first an intravenous line along the needle is inserted to the one of the blood vessels of the patient, preferably a vein in the arm. A nurse will be present along with the patient throughout the procedure. The vital signs will be monitored. Generally, most of the reactions happen in the first 15 minutes of the hemotherapy. If the patient experiences shortness of breath, chills, or any other symptom, they have to inform the nurse or the doctor available, and the procedure will be stopped immediately. Now I would like to hand over it to Sohita.
Yes, ma'am. So next what happens is it usually takes 1 to 4 hours to finish this chemotherapy. and the recovery time depends on the reason for blood transfusion. Like for example, sometimes we may need because our hemoglobin is less, and sometimes when a person meets with an accident, then they might need blood. So it depends on what they are needing it for. And it is better if a person accompanies the patient for the next 24 hours. And as you can see in the picture, a bruise develops around the needle site. And also if the person experiences any kind of effects like fever or anything, they have to inform the caretaker. And here we can see some of the side effects. Usually it is very safe procedure, but then some people might experience effects like skin flushing, shortness of breath and all. And very rarely what happens is if the donor is having diseases like hepatitis B or hepatitis C or HIV, sometimes in their early stages it is not detected in the screening test. So in this way it might spread to the patient as well. And also we have to be very careful about the needles that we are using, because if they are contaminated, there's a chance of infection again. And if you have any questions, you can ask us. Thank you.
Thank
That's all.
you. And whose address and telephone numbers are given here? Samhita's or Manish?
They're just random numbers, ma'am, because in a leaflet at the end, we have them.
Ah,
So
I
we
see, yes. Mhm.
We'll mention them.
I understand now. Mhm. Well, do we have questions to the speakers?
No, ma'am.
No questions. Okay, so for me, this information was new because I've never just read, never seen this, some of these procedures and tests. Of course, I've done the blood test, and this is a very common procedure. But there is a lot of new information for me, and I think that it's also useful for you because you just focused on something that you will just deal with in future as doctors. Okay, thank you for participation, and thank you for such interesting and just well done presentations. And